Most people think ulcers begin with sharp, unbearable stomach pain. But what if that pain is actually the last stage of the problem? The truth is, many ulcers start silently. A little bloating, mild indigestion, occasional discomfort after meals. Symptoms so subtle that most people dismiss them as stress, acidity, or something they ate. And by the time the real cause is discovered, the damage may already be significant. So the real question is, how can you detect an ulcer before it becomes dangerous? First, let's understand what an ulcer actually is. An ulcer is an open sore that develops in the protective lining of the digestive system. It can form in the stomach, the small intestine, or even the esophagus. Normally, a layer of mucus protects these tissues from powerful stomach acid. But when that protective barrier weakens, acid begins attacking the tissue underneath, creating a painful sore. And here's the surprising part. In the early stages, ulcers often cause little or no pain at all. There are different types of ulcers. Gastric ulcers form in the stomach. Duodenal ulcers develop in the first part of the small intestine. And esophageal ulcers affect the food pipe that carries food from the mouth to the stomach. Some ulcers can become especially dangerous, including bleeding ulcers that may remain unnoticed until serious internal bleeding occurs. So what causes an ulcer? One of the most common causes is a hidden bacterial infection called Helicobacter pylori. Frequent use of pain relievers such as ibuprofen, aspirin, and other NSAIDs can also damage the stomach lining. Smoking, excessive alcohol consumption, excess stomach acid, and certain medical treatments can further increase the risk. The dangerous part, many people live with these risk factors for months without realizing anything is wrong. Now let's talk about the warning signs you should never ignore. Pain between meals or during the night. Pain that temporarily improves after eating. Bloating, indigestion, nausea, loss of appetite, or unexplained weight loss. These symptoms may seem minor, but they can be early signs of an ulcer. However, if you notice black or bloody stools, vomit containing blood, or extreme weakness, seek medical attention immediately. These can be signs of a medical emergency. To diagnose an ulcer, doctors may use blood, stool, or breath tests to check for infection. They may also perform an endoscopy, using a small camera to examine the digestive tract directly. The good news is that ulcers are highly treatable. Treatment may include antibiotics to eliminate bacterial infections, medications that reduce stomach acid, stopping certain painkillers, and making important lifestyle changes. In severe cases involving bleeding or complications, surgery may be necessary. Here's the key takeaway. Ulcers don't always begin with pain. They often begin with small warning signs that are easy to ignore. And that's exactly what makes them dangerous. Because the earlier an ulcer is detected, the easier it is to treat. Listen to your body. Don't ignore persistent digestive symptoms. Sometimes, the smallest warning signs can prevent the biggest health problem.